This is the first work about NFL association with progression. In the second work, it is a more smaller scope where we have data from a multi-center study that I initiated with my colleagues in Germany in 2018. It's called PPMS. It's a study in 6 university hospitals and 2 highly specialized MS centers where we are trying to see if measurement of another blood biomarker, which is glial fibrillary acidic protein, GFAP, a marker of astrocyte involvement, can help predict the progression in patients with progressive multiple sclerosis. So the first work was about MS patients in general, but this second work is particularly for patients with what we call progressive MS. And in this work, we measured GFAP in the blood samples that were available and looked when our patients are developing progression over the following around 2 years with median follow-up. And what we found is that if you have high GFAP values, you have higher risk for developing disease progression, particularly in the patients with the so-called primary progressive MS. But the effect was much, much weaker in patients with secondary progressive MS. So that work, this is like very brief summary of the work, would indicate that GFAP might be a very helpful marker to predict a group of patients who are at high risk of developing progression in the group with progressive multiple sclerosis patients. I think with GFAP, we are still in an earlier stage compared to NFL. With NFL, we have so many information about what factors can impact NFL. For example, how age, how body mass index, how biological sex might impact NFL. With GFAP, we are still figuring out all those things. But let's assume that we have figured that out. GFAP, in this case, can help predict which patient will progress sooner. So if I have high GFAP values, this is a patient who has higher risk of progression. So let's imagine hopefully in a few years where we have many different options also for progressive multiple sclerosis, that will be the patient where you want to give the highest efficacy treatment to prevent disease progression. So in this case, there's still some work to do first to really see what impact GFAP, how can we correctly interpret the value of GFAP that we are measuring, but at the same time, we need to have more treatments for progressive MS that we can choose higher efficacy preventive treatment regarding progression in a patient who would have high GFAP. What we observed in that work, when you combine GFAP and NFL, we found that the group that has the highest GFAP and at the same time the lowest NFL value was the group that was closest to the event of progression. And we can't understand this work without actually the first work. So if you look at the data we are going to present in our first work, you will see that NFL is elevated 1 or 2 years before our event, and the closer we get to the event, the NFL levels get low. So imagine you are measuring the GFAP at this time point, and you have high GFAP, and you have this low NFL, you are very close to your progression event. This is what we were proposing using and combining both measurements to predict progression.